morning. Here I am with another brilliant researcher to tell us about the work she does and the why.
Yeah, thank you for having me. My name is Dr. Katherine Hunzinger. I'm an assistant professor at Jefferson University here in Philadelphia, and I'm kind of a weird one. I played sports all throughout high school and college, and I went to college with the military, and I suffered a sport-related concussion and was on medical profile and was dealing with some psychological sequelae of brain injury and kind of dropped my opportunity with the military. So that was kind of my villain origin story. And then I went to graduate school and got rear-ended at a red light in graduate school and suffered from persistent concussion symptoms for about 6 to 9 months and received very different care when I was a student and no longer a student athlete. And that really motivated me to want to go into, helping others, because I saw how there was that delay in dissemination of information. I was told to do a graded exercise return program as a student athlete with a concussion, whereas 3 years later, when I was a grad student with a concussion, I was told sit in a dark room till I felt better. And that was no longer standard practice. And so that really kind of fueled me to do my doctoral work in concussion. And then in my doctoral work, I did a lot of sport work, and then I loved it, but I really didn't feel the public health impact, because that's such doing sports is a privilege. People who are able-bodied and have access to sport is a privilege. And the average TBI patient is not an athlete, and the athletes are already getting great care. They have athletic trainers and team doctors, and they're physically active and able-bodied. And, it's really those older adults that have a fall and they're already low in terms of physical function and vitality and robustness. And so those are the people that I really care about. So a lot of my research now is leveraging big data to really use gait and walking speed as a biomarker of neurologic health, and seeing how that corresponds to physical decline post-TBI, pre-TBI even. And we've done a lot of cool work with concussion and subsequent injury, and now we've done some work showing that those with TBI are actually at risk for a subsequent fall. And those falls really are injurious in these older adult populations, because that can lead to other sequelae like a TBI or a hip fracture. And then they go to the hospital with a hip fracture and get pneumonia and unfortunately pass away. So a lot of cool stuff. So trying to expand my bubble away from the sport world and kind of really get to that big public health impact, and really trying to remind people that exercise is medicine, and that really helps preserve your vitality and help you recover from the brain injury, but also make you more resilient if you do suffer from one.
Fantastic work. I'm so impressed, and thank you for joining me.
Absolutely. Thank you for having me, Candace.